You're listening to Health Professional Radio. My name is Wayne Bucklar, and my guest today joins me from Australia. It's Ian Shapland. Ian's the Associate Director of Business Development with Elite Fitout Solutions. Ian, welcome to Health Professional Radio.
Wayne, thank you very much. I'm very pleased to be here. Thank you.
Now, Ian, I could guess what Elite Fitout Solutions does, but it'd be much more sensible if I just asked you to explain it to us. So tell us a bit about the company and what it is you do.
Yes, as you say, there is obviously a certain amount of description in the name, but essentially what we do is we work together with health professionals to design, develop and build the best possible working environment for the clinic or the theatres, the operating theatres, the clinics, or indeed the wards. So it's about essentially becoming a business partner with the health professionals to get an end result that works better for their particular needs.
I see. Now, what geographic footprint do you service?
We cover Australia, Australia-wide. We're based out of Queensland, but that doesn't really mean that everything's in Queensland because we deal with all sorts of professionals from around the different states, but also with our design services as well. That can be quite wider in its own right. We very much have a way of engaging first with clients from the early on stage as when they're just thinking about what they're trying to design, and then we go forward from there, as I say, whichever part of the country that would be.
And I guess there are lots of specialist elements when it comes to health design. It's not, it's neither shop fit out nor household layout. It's quite specialised, isn't it?
Extremely so. I mean, it is one of the misunderstandings, if you like, of the industry about just getting a builder in per se. There are a number of us in the industry that work this way, and we get together very early on. Of course, you've got specialists. It can be gas requirements, it can be X-ray requirements, the infection control requirements and so forth that we're highly experienced in, and I wouldn't suggest going any other way. And you always see when problems arise, it's very often when shortcuts have been made on those fronts.
Yes, and a lot of our listeners, Ian, are clinicians of one kind or another, and we get both acute care and aged care, but we also get our fair share of specialists, and I guess for them it's design of consulting rooms, and I think you mentioned you also do that sort of layout and design work.
We do indeed. So very often, of course, the consult rooms are invariably right next to the hospital. Now, sometimes there could be some area those rooms actually they're clinical in their own right. For example, there could be requirements lighting. I mean, when you're operating close, obviously the lighting requirements change, and as we age, we need a lot of higher strength lighting. So the skill sets of getting that right within the operating and treatment areas are quite critical. Even actually in the consult rooms in the specialist centres.
Now, Ian, for that clinical audience that we have listening, what's the takeaway message that you'd like them to hear today as a result of you being on Health Professional Radio?
Really, it is about getting involved early. Whatever you're thinking of doing, track us down or track a professional company down, and start discussing very early on so that you can match the business requirements of your practice with the clinical requirements of your practice. Get in early before you start going to planning, before you start going down to straightforward design. Let's get things working together first for you.
And I imagine if someone's buying premises, there's even issues about council approvals and stuff if you're going to run a dental practice or a medical practice.
Yes, as I was alluding to there. Very often, if specialist centres are right next to hospitals, of course, there's a degree of assumption that medical would be okay, but you'd be surprised. There's some, in close major metro areas, there's some areas that you still have to go through quite major planning requirements and applications that can be quite costly and take some time. And unfortunately, it's not unusual for us to receive a phone call from someone who's saying, I've just bought this property, I'd like to turn it into a such and such type of clinic. And when it comes down to it, they can't actually change it at all. And advise them they've just bought their first investment property. So again, let's go back to the point of getting early. Once you're thinking about it, it's about putting together a team, if you like. You know, it's not just about speaking to myself. It's about making sure that the finance to do the whole project will come together. The accountancy is from the business perspective. We can make sure that all the building requirements that are in place. You kind of get your team together in the very early stages before you even start laying out too much money.
You're listening to Health Professional Radio with Wayne Bucklar, and my guest today is Ian Shapland, who is the Associate Director of Business Development for Elite Fitout Solutions, and we've been talking about the work they do in design and construction of clinical spaces. Ian, one of my favourite questions in every interview is about misconceptions, and there are misconceptions in every field of endeavour. But in your work and amongst your customers and clients, what's the biggest misconception that drives you nuts and keeps you awake at night?
I suppose it's the thought. The two areas will be planning and the thought that any builder can do the job. So someone's always got a cousin, a friend, a family member that's a chippy, and oh, that's right, they'll come in and do the work. Or indeed the thought that the planning is easy. It's a complete different section within the construction design area of industry, because it is health, therefore that's why we're in the health industry. So if that conception can do, it would make life a lot easier for all the clinicians and indeed us.
Yes, and I can understand how that would be a misconception that would keep you awake. With a little bit of luck today, we might have dispelled some of that with your conversation, and maybe there'll be a few more people who'll be looking to get their team together early if they're looking at building new clinical spaces.
Yes.
Ian, it's been a pleasure having you on Health Professional Radio today. And listeners, if you've just missed my conversation with Ian Shapland from Elite Fitout Solutions, there's good news. We have a transcript on our website at www.hpr, and there you can also find links to an audio interview of our conversation, both on YouTube and SoundCloud. If you would like to get in touch with Ian, the best place to go is www.elitefitout.com.au, and you'll find there all the details to contact Ian Shapland, Associate Director, Business Development for Elite Fitout Solutions. My name is Wayne Bucklar, and you're listening to Health Professional Radio.